Good evening, everyone. My name is Suzanne Tither. I'm a family nurse practitioner with Rose Wellness Center for Integrative Medicine in Oakton, Virginia. Today, I'm diving into a really fascinating topic, and that is the mystery of the thyroid gland. This webinar is hosted by Natural Awakenings along with Rose Wellness. Natural Awakenings is just a great publication for supporting holistic and natural health therapies. A little bit about my background. Along with a Master of Nursing, I also hold a Master of Acupuncture. I've worked as both a nurse and an acupuncturist for about 10 years, and then I sought more advanced training in both Western and functional medicine, which really led me where I am today. In my practice, I blend both Eastern and Western philosophies of medicine, and my goal with clients is to really uncover the root cause of illness, symptom, and imbalance, and recognize a more personalized approach to healing that incorporates diet, nutrition, lifestyle choices, pharmaceuticals, herbs, acupuncture, and hormone balancing. So here at Rose Wellness, we work with a really creative team of providers to serve your healthcare needs. Please check us out at rosewellness.com. And just so you know, the presentation is going to be about 35 to 40 minutes. If you have any questions at the end, please feel free to reach out to us on Facebook. I will give you further contact information at the end as well. All right, so let's just dive right in. So first, just a little thyroid gland 101. What exactly is the thyroid? So the thyroid is located in front of the trachea, which is also known as the windpipe. It sits just right below the Adam's apple. So this is a gland. It's about the size of a walnut, and it's responsible for storing hormones that are important for energy production in the body. So the gland shaped sort of like a butterfly, and it's got it has these two lobes on either side, and between those lobes is something called the isthmus, which is basically connective tissue that sort of allows your body, as you swallow, for the thyroid to move easily. The gland itself weighs about 2 ounces, and within those lobes hold something called follicles, and they're small little vessels that actually hold our thyroid hormone. And so in order to talk about the thyroid gland itself, we sort of need to understand it in the context of the entire endocrine system, which is what it is a part of. And the endocrine system, all of these glands produce hormones that regulate metabolism, growth and development, tissue function, sexual function, reproductive, sleep, mood, among other things. So within along with that thyroid gland, we've got your parathyroid, your adrenal glands, your pancreas, your ovaries in the females, and testicles in the male. And again, the endocrine system stores hormones, and these are released into the bloodstream and send all sorts of messaging to the body cells. So what does the thyroid do exactly, and what's its purpose? So literally the thyroid is responsible for energy production in every cell within the body, and is responsible for overall metabolism. And this is sort of an image of the messaging system that happens within the thyroid, because it's really the brain that controls the release of that hormone, and allows for the proper balance of the hormone within the body. So the pituitary sits in the brain or within the hypothalamus, and it will tell the thyroid whether or not to produce more thyroid hormone or not, and whether the body actually needs it. And there's sort of a feedback loop or mechanism going on here. So in this image, you see that butterfly-shaped thyroid gland, and it's those arrows are pointing to T4 and T3. Those are thyroid hormones. And then you look at this TSH here, and TSH is basically a blood value that we take in order to determine how well the thyroid is actually releasing hormones. So when that TSH goes high or higher than we want it to see, we know the body is deficient in thyroid hormone. It actually needs more of it. And when that TSH goes low, and that's when the pituitary just says, hey, like, we don't need as much thyroid hormone. That signal, a low TSH, means the body's producing too much thyroid hormone. And so basically, that's significant because if your thyroid is either overactive or underactive, you can really experience a lot of wide-ranging symptoms because again, if you think about it, as I said, the thyroid hormone feeds every cell in the body. So it has the potential to impact all sorts of systems and experiences that you're having. So an overactive thyroid, think about it as energy metabolism speeds up. You have too much thyroid hormones, so you can end up having more weight loss, more appetite, sometimes an irregular heartbeat or a pounding of your heart, nervousness or anxiety or a tremor. So um, people who come to me when their thyroid is hyperactive will say, I just can't sit still. I feel this internal sense of sort of movement or anxiety in myself, sweating, change in bowel patterns, and certainly difficulty sleeping. And then an underactive thyroid is really just the opposite. And this is actually really what we tend to focus more on as providers at Rose Wellness. We see a lot of patients with misdiagnosed underactive thyroid, but essentially, the underactive thyroid is the opposite of too much. So you're going to feel tired and sluggish. The metabolism and energy production slows down. So there might be weight gain and feeling cold a lot, constipation, just sluggish bowels, dryness. The other thing I see a lot of is brain fog. So it's like, if there's not enough energy moving in the brain, you just can't think right. So this is basically the opposite of hyperthyroidism. And let me go back there actually, and we're going to get into this in a little later slide. But as you see, underactive thyroid is sometimes called the great masquerader. And why that is because a lot of these symptoms can be linked to other issues, fatigue, depression, weight gain. There can be different reasons why a patient might have those sorts of symptoms. And it isn't always linked to the thyroid, but oftentimes it is, and it's getting undiagnosed. All right, and let's just go over a little bit of statistics. So I just mentioned, highly underdiagnosed condition. About 20 million Americans suffer from improper thyroid function, and up to 60% of those with thyroid disease aren't even aware that they have it or are aware of their condition. Women are 5 to 8 times more likely than men to develop thyroid problems. Some of that has to do with women's hormonal balancing system, in reference to reproduction. 80% of hypothyroid conditions in the United States are actually thought to be more autoimmune driven. And we're going to talk about that in a little bit. I like this quote by Dr. Shames. Although extremely common, low thyroid is a largely unsuspected illness. Even when suspected, it is frequently undiagnosed. And when it is undiagnosed, it often goes untreated. And when it is treated, it is seldom treated optimally. So we really take pride in our approach to our holistic approach to making sure you have the most optimal functioning thyroid. So some causes of hypothyroidism would be iodine deficiency, autoimmune or Hashimoto's, medications and chemotherapy, pregnancy, stress, something called adrenal fatigue, chronic infections like mono or Epstein-Barr, that they can actually trigger hypothyroidism, hormone changes, and nutrient deficiencies as well. And we're going to talk a little bit about the actual thyroid hormone itself. So I had mentioned that, there's two primary thyroid hormones, T4, which is the less metabolically active form of the thyroid. And T4 actually needs to convert into T3. T3 is the metabolically active type of thyroid hormone. So that's actually what helps with weight loss and energy metabolism. Now, the thing is, both T4 and T3 need certain building blocks to make that thyroid hormone. And so I mentioned that iodine deficiency. Well, iodine is one of the things that will make thyroid hormone. And we certainly live in a country that, where we have some iodine deficiency. You're going to see it all over the world, really. But, compared to Japan, the diets in the United States have sort of like 8 times less the amount of iodine in them. Obviously, iodine comes from things like seaweed and oysters. You can get some from eggs. But for the most part, we do try to iodize our salt to get that proper amount of iodine in the system, but we don't always get it. So sometimes we will look at iodine for thyroid patients and make sure that they're getting enough in their diets, or at least getting a supplementation of it. Tyrosine, which is found in chicken and fish and poultry, also a building block to the thyroid hormone. The other thing I mentioned is that T4 has to convert to T3, and T3 again is more potent of a hormone, but we need certain minerals in order to do that. So things like zinc, selenium, and that iodine again, and iron. So our diets are hugely important in how well our thyroid functions. The other thing is that some medications actually halt or disrupt the adequate conversion of T4 to T3. So beta blockers, which are a very popular medication for reducing hypertension or high blood pressure, alcohol can impact that conversion, nutritional deficiencies, and if there's any sort of absorption issues in the digestive tract. So, one of the things we do a lot as functional medicine providers is we look at the how optimal your digestive system is working, because that can then impact your endocrine system, and it has a huge impact on the body overall. And so I mentioned this before, but Hashimoto's thyroid or thyroiditis is an autoimmune condition. It's in a case where basically the body has an inflammatory response where a person starts to have antibodies to their own thyroid, and then it either destroys that tissue or it prevents it from working as optimally. So it's a gradual destruction of the thyroid gland. Oftentimes this gets missed. Sometimes, providers will detect a thyroid issue, but they won't really hone in on the fact that it is an autoimmune condition. But that is relevant because an autoimmune condition is signaling an inflammatory response in the body. And there's all sorts of things we can do nutrition-wise and dietarily and lifestyle-wise and supplement-wise to reduce that inflammation so that your thyroid has less pressure on it and it can produce more hormone more effectively. So what is the medical dilemma? Well, I've sort of mentioned this before, but essentially improper thyroid function is often misdiagnosed. A person's told they have depression or perhaps premenstrual syndrome or, some other issue, they're gaining weight and they're told, well, you just aren't exercising enough. A lot of times there's just sort of vague symptoms. And so, and then even so, the way the condition gets diagnosed, sometimes the labs don't exactly express what's truly going on. And I'm going to explain that a little bit as we move along. So it's estimated that 1/3 of hypothyroid patients have normal blood test results. 20% of patients hospitalized for severe depression were actually found to have Hashimoto's or hypothyroidism, and 52% of patients with untreatable major depression actually have hypothyroidism. So, just kind of a cartoon to sort of show, it sounds to me like you're just a little depressed, but meanwhile, some of that depression is driven by something very different, not just thought processes, but perhaps a hormonal imbalance in the body. Oh, and I don't know what happened here. Let me just, okay, there we go. All right. Sorry, I'm having a little. Okay, apologize. Not sure what happened there, but okay. So how do we diagnose a thyroid condition? Well, we do a clinical evaluation. We certainly take some laboratory tests. Sometimes we'll do a body temperature charting analysis because when a thyroid is low, clients will sometimes find they're cold a lot and their temperature actually runs lower. We even do an adrenal function analysis. And this is sort of talking about the adrenals. It's like a room for an entire other webinar, but which we will do in the future. But the adrenals are essentially two glands that sit on top of the kidneys, and they're responsible for our fight or flight response. So they're a stress gland, but the the adrenals and the thyroid sort of work in conjunction with each other. So sometimes when the adrenals are taxed or weak or overstressed, the thyroid won't function as optimally. So we do try to tune into the adrenals quite a bit when we're looking at the health of the thyroid. So the other interesting thing about thyroid testing is, there are questions of, can we really rely on what's considered normal ranges? So remember I spoke about the TSH being an indirect marker for thyroid function. As that TS rises, the thyroid hormone is low, and it means we need some replacement. Normal ranges of a TSH are anywhere between 0.35 to 5.5. Now, what's interesting is as high as 20 used to be an acceptable range for a TSH. So over time, we've really started to tighten those ranges. And we know truly most people feel optimal when their range is between 0.5 and 2.5. So if the normal range is considered 5 and you're walking around with a TSH of 5, but you're exhausted and you're gaining weight and you have a lot of brain fog and you're feeling cold all the time, we know that you actually probably are someone who's a lot happier when your TSH is at a 2.5. So, this is something we test, we really take very seriously. We look at your TSH, we'll look at your thyroid hormones, we'll look at your thyroid antibodies if we suspect that there might be an autoimmune issue. So, comprehensive thyroid testing is key to proper analysis and figuring out a proper approach and personalized path to your healing. And then again, looking at normal versus optimal ranges. Well, suppose optimal zone is right there in the middle. Well, if you're really, really on that low end, you still may not feel so good. So we want to get those laboratory ranges in optimal range. And I just like this cartoon because I hear this all the time from patients. They come in and say, well, I was told all my tests look normal, that there's nothing wrong with me, but actually I feel absolutely horrible and I have all the symptoms. So what does that mean? And so sometimes it can mean that while you look like your lab values are normal, they're in the very low normal range. And for you, you like to be more you like to sit somewhere else. So we figure that out for the individual. All right. And then hormone assays are another important test that we'll do. We also do, as I said, I mentioned the adrenals. We take close watch on those. We also look at any vitamin and mineral deficiencies. We even consider chronic affections in context of the thyroid, because that can certainly trigger things and trigger a low thyroid. So we make sure the gut is in optimal order, because the gut is actually where we metabolize a lot of our hormones. So it's going to impact that thyroid health as well. And we even look at food intolerances. So, some patients actually have sensitivities to some foods that are inherent. Sometimes the sensitivities are coming because the gut isn't optimal. We find that gluten tends to be really pro-inflammatory for patients with Hashimoto's. So we will tease all that out to come up with a proper dietary plan that supports your needs. And how do we manage hypothyroidism? Well, again, looking at diet, nutrition, correcting those vitamin and mineral deficiencies. detoxifying the body, treating any unwanted infection, and also potentially giving actual thyroid hormone. So synthetic hormones we will use. These typically are basic pharmaceuticals like Synthroid and levothyroxine. Sometimes we will use actual T3, again, the more metabolically active form of the thyroid. That can come as a prescription through a regular pharmacy or a compounding pharmacy, because we will give T3 in a sustained release version. So a patient will get little bits of T3 all throughout the day, as opposed to it sort of absorbing in the system real quickly, which is what's more standard for something like Cytomel, which is the prescription based. And then natural thyroid preparations as well. There are some mild ones that are essentially over the counter or in a supplement version that contain herbal preparations. And then there's desiccated thyroid gland, which is derived from porcine, and it actually contains a little bit of T3 and T4. And some patients prefer that to synthetic. Not one is better than the other. It all has to do what is optimal for you. Some patients do a lot better on synthetic, and some do a lot better on natural. And sometimes it just takes a little time to figure out your sweet spot and what will allow you to feel your best. And then, of course, we look at nutritional supplementation. I talked about all these minerals previously, the iodine, selenium, zinc, how important they are for the conversion of T4 to T3. We definitely make sure your vitamin D is well in range for optimal immune system. Your fatty acids will reduce inflammation. B complex vitamins are really important for stress response and keeping the adrenals happy, which in turn keep your thyroid happy. And certainly prevention. So how can we prevent our thyroid from getting weak in the first place? Eating a balanced diet is always important. We live now in a day and age where we're exposed to a lot more toxins. You walk outside and, you breathe in car exhaust. I mean, we have a lot of stress that depletes our vitamins. And so really making sure our diets are wholesome and balanced, fruits, vegetables, healthy grains, healthy proteins, and finding healthy fats and the dietary approach that's optimal for you. Sometimes taking a good quality multivitamin, stress reduction, and drinking a lot of water, which really helps with energy production and overall health. And then I already kind of went through these dietary guidelines, just kind of pulling out some key things here. Iodine-rich foods are fish, green leafy vegetables, sea vegetables, selenium-rich foods. So selenium is a really important mineral for thyroid health. So Brazilian nuts, wheat germ, onions, fish, eggs, and kelp can be really beneficial. And there is, this is kind of interesting. One thing that people don't realize nutrition-wise is cruciferous vegetables like broccoli, cauliflower, Brussels sprouts. They're goitrogens, so they can disrupt the thyroid. So typically we encourage you not to eat them in their raw form. If they're steamed or cooked, they don't cause quite as much disruption. All right. Well, thank you so much for spending time with me this evening to learn about how I can help with your thyroid conditions. I love sharing this topic with people who are eager to transform their health. And so I really appreciate your time tonight. Please feel free to reach out. We are accepting new patients. We just love to work with people on their health journeys. So we're here for any questions you may have. If you want to schedule an appointment, our number there on the screen is 571-529-6699. And also, even if it's just questions that you have, please feel free to reach out. So I hope you all have a great evening. Okay, take care. Bye-bye.